Hi, my name is Shay Reitler. I will be demonstrating a subcutaneous insulin injection. So first you would want to do your 6 rights of a medication administration, which is right patient, right medication, right dose, right route, right time, and right documentation. You also want to make sure you're doing your 3 checks before you pull out the meds, after you pull out the meds, and at the bedside. So when I'm going into the med room, you want to use a U100 insulin syringe, or that's what I'm going to be using today. Just make sure you're using an insulin syringe. And with insulin, I'm just going to roll it between my hands here. For a multi-dose vial, I would check the expiration date. I'm going to check if it was previously opened. You would look for a nurse's signature, time, date, and expiration date, which is typically 28 to 30 days after a multi-dose vial has been opened. So since this one is brand new, I'm just going to open it. And then I would put my initials, time, date, and 30 days from now on here. Okay. Put my syringe. I'm just going to pull back the amount in air that I want. And then I'm going to inject that air into here. I'll pull back. Just making sure don't have any bubbles or anything. I can tap it. It looks like I'm okay. And then when I'm going in the patient's room, I'm just going to identify myself, do my 3rd check there at the bedside, identify my patient and any allergies they may have. Another assessment you may want before insulin would be a blood glucose level. So I've checked my patient's name and birth date. I assessed their allergies. I'm also going to make sure I do have the right med, the right dose, right time, and right route. And then afterwards I will do the right documentation. So I'm going to wash my hands and I'll put on some gloves. The subcutaneous injection, you can go for a typical size person, it's about a 45-degree angle. For bigger patients, it's a 90-degree angle, and you're pinching that skin together for the injection. So before I do anything, I'm going to make sure to clean the site. I'm going to use the abdomen. You want to go about 2 inches away from the belly button and make sure that you're going about 1 inch to 1.5 inches away from where they were previously injected, so they're not getting a bunch of bruises and knots on their abdomen there. So I'm just going to clean my site. And then I'm going to do the 90-degree angles injection. So I'm going to make sure my bevel is up. I'm going to pinch that skin there, go in 90 degrees, push in my insulin, pull out, and then I would just recap my needle here, put it in the sharps, and then I could take a gauze and just wipe this up a little bit. It shouldn't bleed or anything. Then I'm just going to assess my patient and document my insulin injection.